My name is Grace Chang. I am the founder, CEO, and principal software engineer at Kintsugi. And at Kintsugi, we're really excited to be building smarter mental health care infrastructure where we're using voice biomarkers to measure and predict well-being. So at Kintsugi, I was really delighted to meet my co-founder just a few years ago in San Francisco at an OpenAI hackathon. We, interestingly enough, shared a common entry to the U.S. Myself, I immigrated from Taiwan and Rima from Kazakhstan. And we had this similar challenge of being able to access mental health care through our provider. And it was myself a few years ago trying to call for almost 5 months at a time to schedule that first therapist appointment and being met with just the sheer challenge of being able to reach anyone. And if this were my dad or my younger brother, I feel like that would be totally unacceptable. And Rima surprisingly shared with me that when she had postpartum with her first child, she was recommended to see a therapist. And similarly, she was calling for 2 months at a time before she was able to reach anyone. And I think for us as engineers, maybe we see this problem through a different lens than that of clinicians who we know definitely want to be able to help their patients. And that's that we saw this as an infrastructure issue where you have so many people trying to jam through the front door, but not a lot of visibility as to who is seriously depressed and who is in these low to moderate states. So if we can create some visibility, reduce the stigma around mental health, and create some quantitative measure to help our practitioners, almost with a lane assist technology, to get patients to the right level of care at the right time, this felt like this was incredibly meaningful work. And so in the early heyday, when we were struggling through the challenge of being able to access mental health care, we did a deep dive in working with clinicians to understand what are some useful self-practices people can initiate to help mitigate these sort of challenges. And it started in this area called Penn-Backer's paradigm, which states that actually in the articulation of top-of-mind issues, there are physiological improvements to mitigating stress, anxiety, and depression. And so we thought, well, I do remember having to journal in like middle school and high school, but that kind of fell by the wayside because as you become an adult, you have so many other obligations. But maybe since people were already talking to their devices, people would consider voice journaling. And so when I put out this first consumer-facing application, it was quite rudimentary. But as Rima and I continued to use it, this had evolved, and now there are users of the Kintsugi's voice journaling application in more than 250 international cities. We've had more than 100,000 downloads in the last year, and this together has formulated the largest annotated voice repository specifically for machine learning and mental health. Here we had a quite significant and robust data set from all over the world, which we've abstracted away and learned that actually the most significant piece of determining depression and anxiety is not what people say, but how they say it. And our model performance, quite interestingly enough, is not based on NLP or natural language processing, but rather signal processing from the features of how people are speaking. And our architecture, as a result, had become much more elegant to be able to perform these real-time calculations. And because we were more focused on how people were speaking, the benefit of that is that we preserve privacy first. And second, because we had a much more elegant architecture, we could perform these calculations in real time. And the third benefit, which was a bit surprising to us, is that because we are only focusing on how people are speaking, our models are language agnostic. So people can be speaking in French and Chinese and Japanese or otherwise, but really we're only looking for the biomarkers that are most predictive of depression and anxiety. And this has been a really big leap forward in voice technology, particularly as it pertains to voice biomarkers in the healthcare field. We are working with Division I athletes to be able to monitor how they're doing over time. And most in this cohort have seen that having this sort of additional app support to being able to vent and talk about these challenges raises a lot of critical issues they may have missed otherwise. Coaches that we've worked with have been really enthusiastic about being able to add additional ways to measure performance and additional ways for us to understand where our weak and blind spots are. We were the first engineers to use our own product, and so we've had the benefit to go through hundreds of these iterations. For myself, it's really understanding that I'm surprisingly a lot more sensitive to spending more outdoor time. It's been really great moving from San Francisco to Berkeley in the time of pandemic because it's given me so much more access to amazing hikes behind my house. And I've definitely taken more advantage of ensuring that I make that time for whether it is going to like my local gym at 6:30 every day and having those evening walks to ensure that there is balance between building a transformational startup in this field of mental health and maintaining my own mental and well-being. Kintsugi does have a personal meaning for me. So several years ago, I was on the path to burnout, and I had taken a step away to travel with my significant other. And we were traveling to Japan for a medical holiday with his father. And I had never gone to Japan before. And I was just really surprised by the culture and the attention and care that was just like in every, crack and crevice of the cities that we had visited. And there was one specific event that I'll never forget. I went to an exhibit called the D47 for the 47 prefectures of Japan, and it was a design exhibit in Shibuya in Tokyo. And I remember as I walked into that exhibit, there was one corner of the room that had these textiles that were worn through and re-embroidered, and then another area that had these ceramics that were broken and rejoined together with this gold enameling. And thematically, this idea is called Kintsugi, and it means that in the process of repair and restoration, you can make something that much more beautiful. And I had never heard of anything like this before, and it really resonated with me, and it just gave me just the little bit of courage to leave like a tremendously successful company to start something that we know now as Kintsugi. At Kintsugi, we are really excited as a team to be transforming access to mental health care by being able to take these signals that are really just thrown away and transforming it into usable information so that we can kind of tamp down on all of this administrative and operational overhead. We have this really unique opportunity in this time, like during COVID, when a lot has moved to virtual care, where we can improve infrastructure from ground up and help enable clinicians and practitioners to get patients like our moms, our brothers, our sisters, and otherwise to that right level of care. For anyone who would like to connect to us, I invite you to visit kintsugihello.com. We have an active presence there where we're always updating information and content, and we also have live people answering any sort of questions and requests.